Hi, I'm Dr. Scott Segal. I am the co-founder of Segal Trials and president of the company. I'm also an investigator on several studies, including the observational study on Tourette's and autism. So autism is a spectrum. People refer to it now as a spectrum disorder, but it's been called over the years pervasive developmental disorder, autism, and there's a whole spectrum of mild to severe within that range. And it's generally characterized by difficulty socializing with others, also having a narrow focus on things, having speech peculiarities, just developing differently than other children. Tourette syndrome is a tic disorder, and so with Tourette's, you have to have vocal tics, such as grunting, like, and motor tics, which is maybe your head or your eyes having a tic. And it's unlike other types of minor tics that people sometimes get. They're really called fasciculations, but sometimes people feel their eye twitching like that. That's not a tic. It's very tricky because a lot of mothers especially think their children have autism. Fathers are usually not as observant, and sometimes kids always develop differently. So usually some kids that are severe you could see early on, as early as 3 months or 6 months old. Others it takes till they're older, 3 years old, 4 or 5, till it's really discovered as they interact with people. But certain signs are that the kids, especially if someone has more than one child, they may say, well, this child's developing differently. But it can be confusing because, for instance, girls develop much quicker than boys. So someone that's had a girl first and the boy second automatically thinks something's wrong with the boy. They catch up later, at least I think. Women may disagree with me, but the kid, let's say at 6 months old, would not be smiling back at you, wouldn't be interacting, their language is not progressing. Those are typically the signs you see. No, that would generally, now if you read a book on Tourette's, and I've had patients that have looked at that, they have many comorbidities. So they could have depression, OCD, which is obsessive compulsive disorder, and many other things. So it can be confusing what's causing it, but you have to have the actual tics. And it's not easy to see because people, kids especially, are very self-conscious of this, so they try to hide it. So if somebody has a vocal tic, now it's very easy. In the older days, we used to see people with sentences. They would blurt out things, usually inappropriate things at times. Now it's more, you see just this sort of grunting, and they'll hide it. So if they start to grunt, like they'll cough with it. And so it's tricky, and they try to hide it because they're uncomfortable with that. Same thing with if it's let's say a neck tic, they'll go like that. But eventually parents catch on and get the kid to talk about it. And so it's not always easy to see. On an autism standpoint, there's really nothing on the market that is out there to treat the core symptoms of it. And the biggest symptoms are the socialization. And there's certain medicines right now in study that may be helpful for that. So right now, the only things that are approved for autism are for irritability related to it. And there's a couple of antipsychotic medicines that have been approved for that use. And we get many referrals to our clinic with kids with autism, but they have comorbid problems such as attention deficit, so we'll treat them for other hyperactivity. But I really am very optimistic. There's a lot of energy put in right now to autism research, and I really applaud the companies doing it because it's a tricky disorder. We don't know exactly what causes it. There's many different factors. We do know it's disabling. We know it's on the rise. It used to be 1 in 100, 1 in 200. Now it's about 1 in 60 kids are getting autism, and it doesn't spare anybody. It could be from very wealthy people to very poor people, and you could have one child that has it, one that does not, and it could be many different factors. So to try to tackle that study is not an easy feat. So Tourette's, we've had medicines for the years. There's been one that when I was a younger man, we used to use this medicine called Orap for it, and no one really uses that medicine for anything other than Tourette's, but there's other medicines that are newer, and even though they're not, quotes, approved for them, we use them generally instead. So there's been Haldol, which we use. The problem with medicines like that, Haldol is more of an early generation or second generation type of medicine. It can cause movement disorders. And so it masks it while you're on it, but it could actually be making it worse. So we try to not use it. However, if the condition's so severe, we have no choice. And then Abilify or aripiprazole has been approved as well, and that has less problems. So we do that. And then off-label, for years we've been using clonidine or 10X, and they're somewhat helpful, but not great. So we certainly need to find newer and better ways. So what happens, this is a great question. When you look at an ad these days, it's a wonder anyone takes a medicine. They could talk about, let's say, dry eyes. And then at the end, they have a disclaimer, may cause death, may cause this, and it's just the scariest thing in the world. These are any condition that just happened to happen, that came up during the study. A lot of times not really related to the study medicine, but they have to say it. So common side effects are pretty rare, but you can get sedation. There's a black box warning on all antipsychotics that it can cause lipid changes and diabetes. Although we don't see it that much, it's still a concern. And so it seems to be overplayed, the warnings for it. However, it can happen. And the problem is these are slow growing sort of problems like high blood pressure. They talk about silent killer. It takes 20 years for it to do something. Similarly, having increased cholesterol is not going to do anything to you today, but it's not a good thing for later. So the important thing is to just monitor these over time. And as we have newer medicines, they have less of those potential problems. But there's also weight gain. And we see it a lot in autistic kids, because autistic kids are, not only do they come from wealthy and poor families and from all sorts of different areas, they can be extremely intelligent, brilliant. You've heard of idiot savant. Or they could be mentally retarded. So it's the whole range of everything with them. And the speech is a huge issue. And so that's where, when you do catch it early, you give speech therapy, and that's one of the most important things that one can do. But they tend to be impulsive in the state of themselves. So when you give these medicines, sometimes they gain a lot of weight, and it's really hard to stop that. So that's one of the challenges with these medications. So the benefits of these types of studies are that in any individual patient, so let's pretend, it's me, I'm the parent, and I have a kid in there, I may or may not see changes in my kid, but that doesn't give an idea of really what's going on with the whole population and universe. Same with a doctor. They may have a few patients with this, and their patients may or may not be having problems. But when you have an observational study and studying larger pools of patients over time, you get to really see what's going on. That way we can decide what the best course of action is for patients and what we need to study. An example is my wife right now is going through breast cancer, and with that there's an observation study right now that they have for, if they, like all studies, they have a lot of different characteristics you have to get in there. And in this one study, she didn't qualify for it, but in that study, if you have a complete response, normally you have to chemotherapy, you have to get radiation. They don't know if you don't need it or they do. So half the people are getting it and they're going to observe it. Half the people will not get radiation. And that will help everyone in the future to know if you really need it or not. There's no way to know unless you study it. Because in any individual patient, results can vary, as they say, and you're not going to learn anything from it.